A very big announcement was made by OntarioMD at the eHealth 25 conference in Toronto. They have been working on a program to help physician practices implement AI scribes. Their new vendor of record program is designed to help practices choose from a list of vendors that have met certain quality and technology criteria. The program also includes support services from OntarioMD. I had the chance to speak with Robert Fox, CEO at OntarioMD, about the program and about their continued work in AI. You'll be very interested in what he has to say. Let's get to it. Rob, welcome back to the program.
Thank you.
It is
Great to be here,
it's
Colin.
always a pleasure to talk with you. We always have interesting conversations. And I have to jump right in because we're here at eHealth 2025 and you have just dropped some pretty big progressive announcements, but also some progress around what we've talked about over the last year, which is this whole push to adopt AI for clinicians here in Ontario. Tell me a little bit more about that program, Rob, that you guys have been working on at OntarioMD for all this time.
Well, thanks, Colin. And yes, we're very excited about AI Scribe. It's been a little while since we chatted, and we're just now announcing that the vendor of record is available to physicians across all of Ontario. We encourage them to sign up through the vendor of record process. They'll have all the information for that. But what we've done is really, if I take a step back and look at the way we got to where we are now, is that we met with a number of stakeholders. We talked about what the priority would be for the next digital idea. And we settled on AI Scribe because of the notional value. So there's a lot of anecdote out there about what AI Scribe could do. So we started to look into it, and then it started to get momentum. And as we dug in more, we saw more and more value. It's truly a technology that helps the providers on so many levels of freeing up time, reducing burden, and really reducing that paperwork, but helping the patient-physician exchange and providing value in terms of the way they talk to one another instead of the doctor's back turned to the patient and document. And we've talked about all that. Since our last discussion, we've done a whole request for bids to the environment, to the vendor community, with a number of clinical and operational requirements, as well as regulatory privacy and security requirements. How data is stored, how it's collected, how it's used. Does the tool actually reflect the clinical exchange that happened between the patient and physician? Does it miss anything? Does it have any hallucinations? Does it have any missing components? And so we've really captured all that. We went through a request for bid process in partnership with the Ministry of Health, Ontario Health, and Supply Ontario. And that vendor of record has now been released. And we're very excited about that because now docs can go to the portal, the OntarioMD practice portal, where they can identify which tools they want to sign up with AI Scribe. Supply Ontario's portal is linked to ours, and the contract management all works seamlessly in the back end. And OntarioMD is there to help physicians who need assistance with adoption and optimal use. Hopefully, we get funding for those tools from various sources to help physicians out in terms of those costs. But what I want to do is step back a little bit.
Okay.
When you look at what we did through that whole process with AI Scribe, number one, hopefully we can do it faster next time with the next identified tool. But I think there's an opportunity now to use this platform and this process and as a mechanism for scaling to other tools. So we've got hundreds of vendors out there with such great ideas and great opportunities. And there's stuff going on in universities and people's basements and people developing things, skunk work projects, which is pure innovation. And then there's ideas that are more evolved, like AI Scribe, where we've identified the value, they're being adopted. And then there's established tools that have been on the market for a long time, but have not been adopted. So I see all of that as digital innovation. Tools that optimize process, make work easier, more automated, and allow us to see more patients and see patients in a better way. And as you know, There's a significant priority in terms of stopping the crisis, which is the primary care challenge for Ontario. And the primary care action team has been formed under Dr. Jane Philpott, who's leading that group and really looking at how do we adopt better adoption of unattached patients in the environment. And a significant component to that success will be adoption of digital tools. So there's a lot of pressure from the PCAT group, we call it, Patients Before Paperwork, and ending the use of faxes and pervasive adoption of provincial digital assets. And then there's obviously opportunities for optimizing practice for physicians as digital practice optimization evolves with all of these digital tools. So how do we muddle through all of those to figure out a mechanism to evaluate them for impact on all those different agendas, and then test them and then scale them to the market? Almost exactly like we did with AI Scribe, but with much greater number of solutions and an agenda to do more with more tools, not just AI Scribe.
And Rob, why is it so important to really put so much energy and effort into adoption? Because that's, I won't say it's a new thing. OntarioMD has been doing that for a long time, but why is that so critical with technologies like AI and some of the other ones that you're describing that may be coming down the road?
Yeah, it's a great question, because we want to have a standard for digital excellence across the province. It's actually why OntarioMD was created, was to evolve the adoption of EMRs, electronic medical records, for primary care across the province. That's how we started, and we are doing the same work, but evolving other digital tools. So that standard is really important, because we don't want docs haves and have-nots. We want to make sure that everybody has the opportunity to use tools to provide optimal care in a most efficient and effective way. But not only that, many of these tools require a collective to be all using the tools so that they can create team-based care or communication mechanisms between different physicians or physicians and patients. So we don't have pervasive adoption of pervasive adoption of the tools. Then, for example, if we don't have secure messaging figured out, then I can't talk to you. Because if I've adopted it and you haven't, I can't talk to you as a care provider in my pool of care pool. So it's, I think, a standardization, make sure that the value proposition is given to everybody in the industry, and to make sure that there's interoperability and integration of these tools across the system to enable team-based care. And without us all adopting a certain initiative, then we're not optimizing it.
And we were just in a panel discussion. It was excellent, by the way.
Thank you.
And there was a statement that I found really interesting during that panel. Dr. Agarwal basically said that, hey, listen, I, as a physician, don't want to be adopting a tool that's going to create liability for me. I want to adopt tools that are proven, that are good, that are solid. Can you expand on that statement? Because I found that truly interesting. I never really thought about the doc being responsible to that degree for the choices they make for technology.
Right. So it's a very good question. There's two areas where docs need help working with vendors. Because one might ask, well, why doesn't a doctor just go and buy the solution from the vendor, install it in their clinic or their care environment, and use it? Well, there's two pieces. Number one is that physicians are negotiating with large companies. So contracts, price, long-term price increases, getting their data back, all of those pieces need to be negotiated on their behalf to provide more value. And that's what OntarioMD's new strategic plan has highlighted, an opportunity to be that broker or buffer between the physician and the vendors. And part of that piece that I talked about was the contract. So how do we protect physicians against liability or issues that may provide risk for doctors when they sign on to those contracts with vendors? So we protect physicians and protect other care providers by establishing relationship expectations, doing due diligence on these companies, making sure the rules are very clear around how data is used, where it's stored, how it's protected. So I think that that's a really important value proposition that OntarioMD provides to doctors and other care providers.
Right. So the liability you're talking about is not so much does this tool work or not, although that is part of it.
It is
It's
part of
more around the hey, listen, there's some rules that we all have to conform to in terms of where data is stored,
it. Hmm.
the security, and as a physician, you could be liable if those are not done properly.
Exactly. And it's not just OntarioMD that's making those decisions. We are working with the College of Physicians and Surgeons, the Canadian Medical Protective Association, the Privacy Practitioner of Ontario, the Ontario government, the Ontario Health, the colleges,
Hmm.
and not only provincial, but also nationally, to make sure that all of that input is heard into what those contracts need to have and not have in them.
I like it. I like it. I think it's exciting that the fact that you are kind of branching beyond AI Scribe, which does have a high adoption because the value was there and clear. Are
Mhm.
you seeking these new tools in that same zone of high value, high impact, or are there other priority areas that you're looking into?
It's a tough question
Okay.
because it's hard to evaluate impact and value
Mm,
because it's a perspective.
okay.
So just because something's going to save money doesn't mean it's a priority for helping the system. Something might have a great system impact, but may be incredibly expensive and would be a challenge to
Right.
fund. So there's a fit on a lot of criteria on how we judge what would be the next priority for the systems. And we include feedback from the government, from physicians, from users, from the system, from the Ontario Medical Association on what are those next priorities. And I think that as we start to roll out AI Scribe, I talked about earlier how this is kind of blowing up the solution environment. AI Scribe in itself isn't just a transient listening between a physician and a patient. It's an opportunity for the system to start interpreting
Mm,
what that discussion is. So even before the patient shows up at a clinic, the AI tool can scrub or filter through all of the history of the relationship between the doctor and the patient to give a summary and things to consider for the doctor uh, before they
to
meet
go
with the
in, yeah.
patient. And then when they're in with the patient, the iterative tool, as it's listening to the exchange, can be bringing up history, can be bringing up diagnostics and imaging, can start bringing up evidence of best practice or considerations around prescriptions or other treatment protocols. And then the post visit is an opportunity for AI Scribe and an extension, the AI tool, to start engaging with other care providers, to start engaging with referrals or follow-up appointments or lab work and other treatments that need to be scheduled or automated with other providers. So I think we're going to see a big opportunity around this, what I call the 360 approach to clinical care. And and that will really start to balloon where AI Scribe can go. Kind of like when we invented the internet. When the internet was invented, it was just used for email, and then everything. Obviously, our lives are run supported by the internet now. It's the same thing. AI Scribe is going to start to balloon out in the functionality that is being offered as these tool functionality capabilities start to emerge. But what I am seeing in what I've seen at HIMSS, the meeting in Vegas recently, in terms of my research and my meetings with other jurisdictions, is that clinical decision support supported by AI is a very popular area right now.
Yeah.
We're having a lot of discussions with the government around what's that mean and how can OntarioMD help and how can we start to look at that as a tool to support physicians. Again, looking at their patient population, what follow-ups are required, what clinical indications require intervention, and also a tool that can help physicians during the visit. So what does that clinical decision support and decision-making look like, and how can doctors be supported by that? And what's the value proposition in adopting that?
Yeah, I think you've really identified that AI scribes are evolving into AI assistants, right? Like they can now surface information to the doc. It can carry out and execute orders, during the visit, post visit, and it's no longer just ambient listening,
Hmm.
which is where it starts, but it's now going to be able to do all of that. And we're seeing that growth in some of the tools that are out there. So
And
pretty
that's
exciting.
that's our area of focus around digital practice optimization. It's not just process; it's also the clinical environment and how do we create a digital support for physicians that takes it to the next level and leverages these digital tools as best we can.
When we get together later on this fall at your conference, what will we be talking about at that point, Rob? Like, is there anything that we're going to be that you hope that we're going to be chatting about and getting excited for?
I'm really excited, Colin, about what the next few months hold. So
Okay.
it's to focus OntarioMD around what does that digital plan look like. We talked about our ability to inventory solutions that are out there, to start to prioritize them and start to test them in a lab environment, and then in situ in a clinical environment, and then figure out where the next best thing. So that's an innovation funnel that we've got. We've also got that's driving innovation. We also want to drive value to physicians. So how do we push the adoption of digital tools and opportunities for, as we talked about, representing the physician in the vendor management and vendor opportunities. So that's another big one for us. But I think you're going to see some really exciting developments in the area of primary care action teams. So this is the adoption of unattached patients in the province. That's going to be a big priority, and we've been speaking with the PCAT team about how digital would be a critical enabler and how we would introduce new technologies and systems and integrated systems to support that. And I think you're also going to see a lot of transformation in the area of integration at the system level. So getting primary care data into the provincial data repository. There's some policy issues. How do physicians work with sharing that data, and what is the benefit to physicians in doing that, and how can we create population health? I think we're going to see some action in that space as well over the next few months.
Last question for you, as always, where can people go to learn more about OntarioMD?
Absolutely. Come to our website. There's contact information there. Please go to the OntarioMD.com website and reach out to OntarioMD if you have any questions or if we can help. We are available for anybody in the field, physicians, OHTs, primary care networks, or any other system needs. We're there to help. Please reach out to us. And I'm always available through OntarioMD or LinkedIn or other processes.
Well, sir, it's always a pleasure to have you on the program. Thanks for all the great information you shared again.
Colin, it was a pleasure, as always.
Hey, I really want to thank Rob for agreeing to join me on camera to speak about OntarioMD's work with AI. I really do appreciate his willingness to share information and his openness about the program. It's nice to get that insider perspective. Now, it's clear from Rob's comments that AI is a top priority for both OntarioMD and for the physician practices in Ontario. It can be very confusing for practices to know which solutions are real and which AI solutions are vaporware. Having a vendor of record system like the one that OntarioMD has proposed and put out there will be pretty helpful. I'm looking forward to catching up with OntarioMD later this fall to see how the program is progressing and to see what changes they will be making based on feedback from both vendors and practices. I'm Colin Hung here at eHealth 25 in Toronto, Ontario. Thanks for watching, and I'll catch you on the next video.